The U.S. Department of Veterans Affairs has begun initial COVID-19 vaccinations on high-risk veterans and healthcare employees. And to talk more about that, we're joined by Dr. Jane Kim, the VA's Chief Consultant for Preventive Medicine. Good morning, Dr. Kim. Thanks for being with us.
Hi, thank you so much for having me.
So we saw that the VA received more than 70,000 Pfizer doses this week, and I'm just curious how the department is working to vaccinate veterans and healthcare employees as quickly as possible.
I am thrilled that we received our first supply of COVID vaccines this week in VA, and the first person to be vaccinated in our system was a World War II female veteran on Monday in Massachusetts. That was a great moment in VA. Since that time, we have vaccinated all week at many medical centers across the country, our healthcare personnel who are on the front lines, as well as our veterans who are living in our long-term care facilities.
So how many VA facilities have access to the vaccine today, and how many more are expected to?
Sure. So currently for the Pfizer vaccine, which was authorized by the FDA last Friday, we have 37 medical centers who have it and who are giving that vaccine this week. Today, we actually expect that the FDA will authorize a second vaccine made by Moderna. If that happens today, we expect that many more medical centers across the country will receive the Moderna vaccine and start vaccination next week. So a lot more to come even next week.
That's good to hear. And one last question before you go. When it comes to veterans getting the vaccines, especially, when they become more available, how will it be distributed? Is there an order for which veterans will get the shot first?
Yeah, the order of who will receive vaccine is based on risk. And the reason that there is a risk kind of based order for this is that the vaccine is in short supply. It was just authorized, one vaccine was just authorized last week, and another will be authorized, we hope, today. But as we open the doors, there is not enough vaccine initially for everybody. So we are working with the CDC to make sure the vaccine goes to those who are at highest risk first, which include our healthcare personnel and our veterans living in the long-term care facilities. After that, we do plan to offer it to those who are also at high risk in the community, so our veterans who are older and who have high-risk medical conditions, for example. And eventually, our goal is to have the vaccine available to any veteran who's enrolled in VA healthcare who would like to be vaccinated.
All right, Dr. Jane Kim, thank you so much for taking the time to join us today.
Thank you for having me.